Wonderful. Good morning, everyone. My name is Rochelle Trigueros. Thank you for joining the Bay Area Council for our Bay Area Impact webinar series. In honor of the legacy of the late Bernard J. Tyson, Chairman and CEO of Kaiser Permanente and former Chair of the Bay Area Council, the American Heart Association's Bernard J. Tyson Impact Fund has invested over $1.1 million across 10 minority and women-led organizations addressing health inequities exacerbated by the pandemic, with the goal of reducing social and economic barriers to health equity. Today, we'll be hearing about this fund and the on-the-ground work of the incredible community leaders advancing equity in our region through the Bernard J. Tyson Impact Fund. We will be saving time at the end of this webinar for questions, so please take a look at the Q&A box below and type in your questions there, and we'll get to as many as possible. I'm thrilled because we have a surprise guest today. We're honored to be welcoming Denise Bradley Tyson, founder and chair of the American Heart Association's Bernard J. Tyson Impact Fund. Denise, thank you so much for joining us today. In addition, we have Erica Maxwell, Vice President of Mission Advancement with the American Heart Association, Max Gritzik, Portfolio Manager of Social Impact Fund with the American Heart Association, and Abner Mason, founder and CEO of Consejo Sano, Sierra Segura, Director of Programs and Policy with Mandela Partners, and last but not least, Armando Hernandez, Vice President of Community Programs with the Unity Council. So we've got a jam-packed webinar today, and we're really thrilled to have these great speakers. And thank you all, audience, for tuning in, prying yourself away from CNN. I know it's been a stressful 48 hours, but we're really excited to talk about some great local work that's happening. So with that, I'm going to turn it over to Denise to share a few remarks. Thank you.
Thanks, Rochelle. Good morning, everyone. And I would just like to take a moment to thank the leadership of the Bay Area Council, Jim Wunderman and Mary Huss in her role as chairwoman, and the many organizations who are represented on this call who have already committed funds, not necessarily to the, I'm sorry, I have a fire drill going on in the back of, that I would like to thank the organizations, throughout the, who are members of the Bay Area Council for their support around the critical issues of racial and social inequities in the Bay Area that are plaguing our communities. And I'd like to take a special, take the opportunity to say a special thank you to the individual donors and corporations who've already signed on to support the work that's being done through the American Heart Association Bernard J. Tyson Impact Fund, that was set up in my late husband's honor. And as many of you know, we're approaching the 1-year anniversary, unbelievably for me, that it will be a year come next Tuesday, November 10th, since he passed. And wow, what an amazing world we now live in. To the extent you're listening to my fire drill in the background, but just in terms of just what's happened with, as a result, even with, we knew that there were issues, that plagued our community, from homelessness to mental, health issues, to food insecurity, to education disparities, to disparities around economic opportunities for, particularly for Black and Brown business owners. But I think working together, we have the opportunity to address some of those inequities in terms of partnering with continuing the work through the Bay Area Council, but also with the companies that we're talking to in the Bay Area, because I think we all care so deeply about this amazing community that we call home. And what affects one affects all of us, you know, directly and indirectly in terms of our Bay Area ecosystem. So I look forward to the conversation in terms of us having a discussion, one, hearing about the folks who've already benefited from the funding that the American Heart Association Bernard J. Tyson Impact Fund has already allocated. And our strategy is that, you know, and I heard Bernard saying in my head, because initially we were looking at postponing launching the fund until we got through the pandemic. But, you know, I was restless just hearing him, you know, in my head that the time is now, that we have to act collectively now, because the need is so great and the monies are needed now, that we will lose a lot of those organizations and individuals if we don't sort of strategize about how we can work together to solve some of these pressing matters in our community. So thank you again for those who've already committed funding to using us. And again, just one other remark, you know, all of you know that Bernard was an authentic brand, as it were, as is the Bay Area Council, as is the American Heart Association, that I think, you know, us partnering together, we sort of remove some of the issues and concerns people may have about, is their money going to what its intended purpose, in terms of knowing that working with us, that the dollars will be spent exactly where people have designated. And we have so many issues and causes where those monies can be deployed here in the Bay Area. And in terms of transparency, you know, for me, I'm not paid by the American Heart Association or by the Bay Area Council. This for me is truly a love letter to man who so enriched me in my life personally, for the time that I was his partner in life and his wife. And, you know, he worked so hard, but yet he left so much, you know, there's so much work to be done that he highlighted and informed us about, that now it's up to us to sort of follow through, in terms of him having sort of opened the door on those issues for us to work together to make a difference. So with that being said, I turn it back over to you, Rochelle, in terms of running the meeting, but thank you for giving me the opportunity to have a few words. Appreciate all of you.
No, we're so, you know, grateful that you were able to join this webinar. And on behalf of the Bay Area Council, we want to thank you for your and Bernard's leadership in the business community to increase equity in our region. It's really, you know, commendable. And you should have seen all the messages that we were getting, you know, from putting on this webinar. I think, you know, saying how important you both are to this community. And so thank you so much. So with that, let's hear a little bit more about the fund itself and how we got here today. So I'm going to introduce Erica and Max.
Great, thanks, Rochelle. And I just want to say, first of all, to the Bay Area Council, you have come alongside the Bernard J. Tyson Impact Fund in such a powerful way, and we are really grateful for your support. We wouldn't be here without you, so thank you, Rochelle, and the Bay Area Council team. And Denise, I have shared this with you before. It has been a true honor and privilege to work alongside you to bring Bernard's legacy to life. And so I just thank you for that gift. You know, obviously most of you know that Bernard was the chairman and CEO of Kaiser Permanente, and hopefully many of you also know that Bernard was a longstanding member of the American Heart Association's board of directors, serving on it for over a decade. What everyone knows is Bernard was committed and was defined by his life's work. And that was changing systems to support integrative and preventative healthcare that considers the whole person and benefits all people. And so to continue Bernard's passionate pursuit of affordable and equitable health and social justice, the American Heart Association has been working with Denise this past year to create the Bernard J. Tyson Impact Fund. The mission of the fund is to advance health equity by doing two things: reducing the social and economic barriers to health. Now, when we talk about health equity, you can talk about the disease of health itself, but where we're focusing, and the American Heart Association has focused on for decades, and we're absolutely focusing on it for the fund, are those social determinants of health. Not the disease itself, but what's going to drive you to disease that we can influence today. As an example, 50 million people in the United States are at higher risk for heart disease because they lack healthy food, clean air, quality education, employment, and housing. Children in area with higher rates of unaffordable housing, and this is heartbreaking, tend to have worse health, more behavioral problems, and lower school performance, which is a lifelong journey of disparity and poor health. Life expectancy of two people living just a few miles apart, and we've seen this in the community, can differ by as many as 20 years. These are the social determinants of health, the primary drivers of health outcomes that have a disproportionately negatively affected our Black, Latinx, Asian American, and Native American communities. And then you add COVID-19, and it thrust into the limelight these unforgivable disparities in a way that our country can no longer, and thankfully, no longer ignore. So the American Heart Association's Bernard J. Tyson Impact Fund is helping close the gaps in these social determinants of health by supporting projects and wonderful entrepreneurs that you're going to meet here today that are changing neighborhoods and improving lives for everyone in them. And so with that, I'd like to turn the next part of my conversation, Michelle, if it's all right with you, over to my good friend and colleague, Matt Gricksuk. Max is the Bernard J. Tyson Impact Fund Portfolio Manager. Max, would love to have you talk about how the fund works.
Absolutely. Thanks so much, Erica. So building off the 2-year track record of the Social Impact Fund, which is the AHA's impact investing platform, as Erica mentioned, the Bernard J. Tyson Fund really seeks to further Bernard's legacy by creating health equity within our country. And the way we do that is by investing in community-based solutions to those social and economic barriers to health equity, with the ultimate goal of driving long-term, measurable, positive health outcomes. The fund recognizes that no one better understands the changes needed in a community than the members who live there, and that there's really no one better placed to drive these needed changes. However, access to capital is not always created equal, and while there are oftentimes innovative local solutions that exist within under-resourced communities, most go overlooked and are unfunded. I'm sure a few of us are familiar with some of these statistics, but just 2% of venture capital funds are invested in minority-led companies, and just 8% of private foundation grants benefit minority-led organizations. So the Tyson Fund really seeks to shift this paradigm through employing a nimble and flexible investment approach that takes the best practices from both the venture philanthropy and the impact investing space to support initiatives that are directly developed from within the community. So unlike traditional funds, the Bernard J. Tyson Fund is largely sector and structure agnostic, which means we invest in for-profit social enterprises, nonprofits, or even individuals working within these under-resourced communities. And we invest in them through a variety of different vehicles themselves, from performance-based grants, low-interest loans, maybe a blend of the two. And on top of that, we also invest in solutions across that continuum of social determinants of health challenges. So again, everything from food insecurity, housing, economic empowerment, recidivism, access to care, and many more. And in fact, when we launch in a new city, we turn to the community to help identify where the gaps exist and how we can best support them to drive change from within. But really, above all, our priority is measurable social impact, not profit or market rate returns, with a particular focus on scaling sustainable, community-led, evidence-based solutions. Tapping into some of our venture philanthropy expertise on the team, our approach is very much collaborative. This isn't one of those programs where we invest some money and say report back on some of these outcomes a year down the road. We provide active technical support and investment management that seeks to build out the investees' infrastructure for growth and helps to create an environment that the investees can actually flourish in well beyond our investment. As far as our process, so our process for investing begins with a very inclusive sourcing approach that intentionally lowers the bar for engagement and seeks to bring in those groups who don't traditionally have access to sources of capital like this. We do so in two different ways. We have an online portal that basically allows anyone from anywhere to apply, but we also proactively source opportunities directly through engaging with key ecosystem actors and other folks directly within the community. Our submission form itself is quite abbreviated and again, intentionally created to reduce the barriers to applying for funding opportunities like this. In many ways, we put the onus on ourselves to actually formulate the investment opportunity around the solutions that are put forward that we feel have the greatest potential to generate long-term impact with the most buy-in from the community that could just be catalyzed from an investment by us. From there, the investments undergo a fairly rigorous financial and impact evaluation that leverages input from both external experts as well as local community members. And every investment once closed, whether it's a grant or a loan, is performance-based and will include and does include an independent evaluation. And we can typically deploy capital in just 2 months. And so with that overview of the fund itself, I'm extremely excited to turn it back over to Rochelle to lead the panel discussion with 3 of the Bernard J. Tyson Fund's inaugural investees in the Bay Area. Rochelle?
Thanks so much, Matt. Thank you to the American Heart Association for all your really important work managing this fund and in the community. We're so, happy to be partnering with you on this. So with that, I'm going to turn it over to our panel of awardees. And so let's start with Abner. What is Consejo Sano and what makes the organization so unique?
Sure. So thank you very much. I'm going to share my screen here. And I have just a few slides to share. So Consejo Sano, first I want to thank the Bay Area Council for inviting me to participate in the webinar. I want to thank the American Heart Association and the Bernard J. Tyson Fund for the funding. And let me just say it's an honor to meet you, Ms. Tyson. It's just an honor to be sharing this webinar with you, and what you've done to continue Bernard's legacy is just incredible. So thank you, and thank you for the funding. My name is Abner Mason. I'm founder and CEO of Consejo Sano. We are a patient engagement and patient navigation company. And what we do is we help to solve a problem that exists in the healthcare system in our country today. And I'll just briefly describe it. We are on the way to becoming a majority minority country. As you can see from this slide, according to the last census, we'll get there in 2050. If the current census is allowed to be completed correctly, I think that'll get pushed even further. So this is huge demographic change. And as you can see, it's having repercussions across our society. Some people aren't ready to embrace this change, but this is who we are and this is who we're becoming. And our healthcare system in the country has not kept up with this demographic change. And that results in poor outcomes for people, particularly low-income people. So today, California is a majority minority state. So is Texas. But if you look at the Medicaid program in the biggest states, including California and Texas, Medicaid is the program for low-income Americans. These are people who struggle to pay because of economic challenges. And so they get their health care through the Medicaid program. Our program in California is it's the largest in the country, almost 14 million Californians on Medicaid, 1 in 3. It is 81% multicultural. 81%. So what that says is that our healthcare system hasn't kept up with the demographic change, and yet it's supposed to serve a population which is overwhelmingly multicultural. That is the problem we're trying to solve at Consejo Sano. We're helping our health plan partners, particularly Medicaid plans, and the providers who serve Medicaid patients to engage with this increasingly multicultural population. These folks are hard to reach. They have low health literacy. They don't have high trust for the health system. And that results in poor outcomes for them and higher costs for society. So the way that healthcare has responded across the country and in California to this challenge of a changing patient population and a healthcare system that hasn't really changed, what happens today is what you see on the left side of this slide is sort of the old approach to engaging that patient. And it's all about language and using one generic message, usually written for an English speaker, and then translating it across 14 or 15 different languages. When you do that, when you send one message to people whose life experience is completely different, and their understanding of healthcare, their trust of the healthcare system is completely different, what you do is you're saying to them, who you are doesn't matter. And when you do that, we shouldn't be surprised that patients aren't willing to engage with us and trust us. And so what we say to Consejo Sano is, let's stop doing that. Let's stop treating people like who they are doesn't matter, and instead use data, public data, private data, claims data. We built a technology platform at Consejo Sano that allows us to ingest all of that data, and then to add to it a deep understanding of how different types of people consume healthcare, particularly low income, undocumented, multicultural folks all across the country, but especially in California. That allows us to do something that we call cultural cohorting, to divide the larger patient population into a smaller group, and then to design the outreach for the smaller group. And when you do that, what you're doing is you're saying to that patient, who you are does matter. We've taken the time to figure out who you are. And when you do that, you build trust, you can engage people, you can get them into the healthcare system, you can get them to do things they wouldn't ordinarily do. That's what we're doing at Consejo Sano. It's unique, but it works. We're getting incredible results. And the funding that we're getting from the Tyson Fund is helping us to further build out our technology, and to expand our solution across the whole state of California, as well as the country. So that's who we are, and that's what we're doing.
That's great, Abner. Thanks so much for that. It is so interesting, thinking about how what it's not just with the healthcare system, but just institutions in general. We have an ugly history of, oppression, obviously, in this country, and especially within the healthcare system itself. And so building that trust back is really important. And so I want to ask you what Consejo Sano's experience has been with the pandemic.
Sure. I should have continued to share my screen. I'll just share it again. When the pandemic hit, we of course had to quickly shift our work. One of the things we do a lot of is work with Medicaid plans and providers, particularly federally qualified health centers. This is where low-income folks get their health care. We were working with them to get people into the clinic. That's our normal work, to close gaps in care, to get kids their physicals, to do breast cancer screenings, and to do diabetes screenings. That was our typical work. When the pandemic hit, we had to switch and say to people, don't come into the clinic. It's not safe. So we, on a dime, really, we had to pivot our work. And I'm really proud of what we were able to accomplish. We were able to, let me see, change the slide. The federally qualified health centers we work with, this is the safety net providers. These clinics make up the safety net in California. And many of them were on the verge of going out of business because they only got paid when the patient came into the clinic. They didn't get paid for virtual visits. Once the pandemic hit, the regulations changed, thank goodness. They should have changed a long time ago, but regulators are slow. They finally changed and said to these FQHCs, these federally qualified health centers, safety net providers, you can get paid for a virtual visit, but their patients had never done a virtual visit. They had always come into the clinic. They had low health literacy, sometimes a bit of struggle with connecting to a virtual visit. We were able to reach out to those patients, educate them about this option, explain to them why this was a better way for them to get healthcare, not going to the clinic. And we were able to generate 50,000 telehealth visits in a matter of about 4 months for populations. These are low income, low health literacy, multicultural, who had never done it before. This not only got those patients health care that was desperately needed. They didn't stop being human because of COVID. They still had all the other issues. They needed to see a doctor. But in addition, it saved these clinics. These safety net providers kept their doors open because they were able, the regulations now changed. They could get paid for the visit, and we generated tens of thousands of visits for them. This was what happens when you build trust with patients. You can get them to do something they've never done before. And we were able to do that. I can't tell you how proud I am of this work, but I'm particularly proud that we helped a lot of these safety net providers keep their doors open, because once they close, if you lose a safety net provider, they may never reopen. They may be gone forever. And so I'm really proud of the work we did and continue to do with these safety net providers.
Thanks so much, Abner. I want to remind the audience that you can use the Q&A box at the bottom to type in questions anytime. Anything, that Abner maybe said that sparked a question in you, just type it out and I'll get to them at the end. Thank you. So it can't be overstated enough how much the pandemic has upended our lives. And I'm sure many of us have read about how the school closures in particular has impacted the food and nutrition that our kids have access to, which brings me to our next panelist. Sierra, can you tell us a bit about Mandela Partners and the role the organization is playing during the pandemic?
Sure. Thank you so much for having me here, everyone. Again, my name is Sierra Segura. I'm the Program and Policy Director at Mandela Partners. Mandela Partners is a nonprofit organization that works to improve health and build wealth in under-resourced communities by primarily uplifting food as a vehicle of community development. For a very long time, I mean, decades really, researchers, academics have been working to uncover underlying causes of health and wealth disparities that disproportionately affect limited resource communities of color. And those community members, on the other hand, have really long understood what they experience firsthand, that they're living in a challenging local food environment. There's a legacy of redlining and economic disinvestment and a ton of barriers to opportunities. And despite a wealth of community assets in these neighborhoods, those neighborhood-based solutions were rarely and continue to be rarely recognized. So as a result, Mandela Partners, previously Mandela Marketplace, was established in response to those challenges, right? So to support the development of a community-directed plan that immediately respected community members' ability to identify their local needs and also uplift community assets. So over the past 15 plus years, we've done this work by weaving together several areas of programming. So from sourcing from sustainable family farmers, creating accessible and affordable healthy food access points, supporting local food business creation and expansion, and then finally increasing capital for entrepreneurs of color. Just to zoom out a little bit, at the most fundamental level, our programs are very much responding to the oppressive systems and racist extractive policies that have led to longstanding disinvestment among the communities that we serve. And all of these initiatives that I just spoke about really work in tandem with one another to, build a resilient local food system that simultaneously is uplifting economic development while helping to ensure that dollars are recirculated into local communities through food, right, through local food enterprises. And in terms of our response to the pandemic, I mean, all the organizations here, we've had to transition our work pretty significantly. On the food access side, we've had to pivot our programs to emergency relief. So over the summer, we changed a couple of our programs that were direct food access to a kind of like mutual aid style programming model that has since evolved into a multi-farm community supported agriculture program. We're also working to secure stable sales channel opportunities for our food hub, Mandela Produce Distribution, which I can talk about later on in the panel. And that multi-farm CSA is really providing that stable food sales channel for our food hub, in addition to building up a client base that are more ongoing and consistent. And this in turn allows us to just purchase more produce more consistently from our network of farmers while simultaneously addressing pretty significant food access needs in the communities that we were previously serving through our programs. On the business development side of our programming, the first stage was providing rent and loan payment relief to our incubated businesses. And then from there, we launched a community meals program with the support of CARES Act funding from Alameda County. And then, of course, we've transitioned all of our entrepreneur supporting programming to a virtual setting. And then I guess the one thing I'll end on is right now we're also working on, we're working with other food entrepreneur serving organizations to urge Alameda County to opt into the California Microenterprise Home Cooking Ordinance, which would create a legal pathway for home cooks to sell their food to the public, which we see as a huge form of COVID relief. So I'll pause there.
Thanks so much. That's really great work that you're all doing.
Thank
So
you.
in addition to the meal program challenge that we've been hearing a lot on the news about, there's another really difficult problem that we in the Bay Area are all too familiar with, which is access to housing. So we were already in a severe housing affordability crisis before the pandemic, coupled with the massive job loss that we're seeing. It's a really scary situation when it comes to housing in our region. So I'm going to turn it over to our third panelist, Armando, to talk about the work of Unity Council and your financial well-being work.
Thank you. Let me see, I'm gonna share my screen. Oh, and before I start, I just wanted to thank Ms. Bradley Tyson for your comments. I was really touched. Thank you for sharing. And for those of you who are not familiar with the Unity Council, we're a 55-year-old organization in Oakland, California. And we actually do work in several different service areas in addition to housing. So I just wanted to show you this slide. I think for the sake of time, I'm not going to go into all of these, but maybe just a couple of highlights. We do real estate, both residential and commercial. We also manage the Fruitvale Business Improvement District in East Oakland. And we have a social enterprise as well as a career center, a senior center, and I believe 6 different early childhood education centers throughout Oakland and in Concord. So it's just a little overview. In terms of our housing services, which is what the American Heart Association invested in our work for, we use an integrated service model, which basically means that we've been working on the back end to cross-train staff and to make sure that there's an easy entry point for residents who may need any of these services. As I'm sure you know, people don't usually just need one thing, or they may not compartmentalize their needs. And so what we wanted was for them to be able to access and to be screened for eligibility into any of these services, regardless of which store they came in through. And so that's what we've been working on. And also, as I mentioned, with cross-trained staff so that they can provide services in at least 2 of these different areas and connect participants to another, with their colleague who might be a specialist in a different area. So for housing, we use a preventive housing model, which means that we don't do active outreach to homeless individuals or organizations who work with homeless individuals. We focus on helping low-income residents to stay housed if they're having challenges to keeping their housing, or to secure affordable housing if they recently lost their home, or maybe they're staying with family. And most of our clients are between 35 and 50 area median income, which is extremely low, from about 17,000 to 24,000 a year for one person. And our strategies include system navigation and application support. It's really a challenge for people to be trying to figure out, what's the difference between applying to a voucher program as opposed to a wait list for a new development building, or in a private market. So we've spent a lot of our planning on being ready to support people with that. And then of course we help, we do some workshops and one-on-one education around housing. And we're part of a network here in Oakland where we can connect folks who are being threatened with eviction for them to receive that service from our legal partners. Financial assistance used to be something we did on a really small scale, and I'll show you in a next slide how that has changed because of COVID. In terms of our financial strategies, we do coaching to improve financial capability, budgeting, and saving. We started this 4 years ago, and we realized that it was really a key to get people housed because, of course, there's only so much we can do with the limited housing availability in Oakland and in the Bay Area. And so what we realized that was going to help us more was to help people to have strong applications and to take steps to be in a more stable financial situation. So we also help to build credit and repair credit. And we have a free tax preparation program because it's important for our participants to take advantage of the earned income tax credit and the child credit. So for this particular grant, this investment from the American Heart Association for our work, what our activities will be is we will enroll at least 100 individuals into housing. We will offer help with education as well as applying for housing. And we will help people with their credit and to provide financial assistance. And as I mentioned, we've had to really change the scope of our financial assistance. And we are fortunate to have funding from other sources in addition to this grant to be able to help people. And just to give you a snapshot of how our financial assistance has changed, this slide here shows the numbers from April when we started our financial assistance, our expanded financial assistance program. So from April to October, we had given out, as you can see in the red and the blue, over $1 million in financial assistance to help people with their rent. And that's both from a partnership that we are part of called Keep Oakland Housed, and also from our own funds that we have been raising. We also have a free lunch program for essential workers at the Unity Council, as well as our social enterprise and a COVID testing site that's near one of our main sites at the Fruitvale. But we also are helping our commercial tenants with rent relief. And we have a small food grant program for very low income clients who are below 35% area median income, which is mostly seniors and low income families here in the Fruitvale. So I think I just wanted to give you a sense of how our services have had to change because of COVID. We are actually planning on going back to our original model, which included, again, the credit checking, the helping people with their banking, and a lot of our folks are still using very predatory banking systems like check cashing and having to pay fees for that. So we want to go back to that as soon as we can, but we really realized we actually had 3,000 applications for financial assistance in 4 months, which is more than we've ever received in a year. So we've been trying to respond to the financial need created by COVID. And I'll pause there.
Thanks so much, Armando. Yeah, I just read an article, I think last week, saying that on average in the United States, the amount that renters owe in rent that they weren't able to make throughout the pandemic is $5,000. And that's an obscene amount for a lot of people in this country. So thank you so much for your work and keeping people housed. So we've heard about nutrition programs, healthcare programs, and housing programs. And the thing that ties these different organizations serving diverse needs together is that each of you are helping address the social determinants of health that we spoke about a little bit earlier. So I want to turn it over to Sierra and Armando to talk a bit about how nutrition and housing help address these social determinants of health.
Yeah, sure. As some context, in 2019, I think a little over 12% of Alameda County residents, or about 200,000 folks, were food insecure. So that means those residents didn't have enough food to lead what the USDA would consider a healthy, active lifestyle. And the USDA is the United States Department of Agriculture. And on top of this, nearly 40% of those food insecure Alameda County residents earned too much to qualify for government benefits such as CalFresh or SNAP. And of course, these numbers have only been exacerbated by the pandemic, as we all know. And Black, Indigenous, and other communities of color face disproportionate rates of hunger already, but more so now. And when compounded with other forms of disinvestment, such as racist, commercial and residential redlining, job loss, housing insecurity, the health of these communities are dramatically impacted, not just in the present, but across generations. And at Mandela, we really work to address two competing food access and economic challenges that we think are very linked to the social determinants of health. So the first is ensuring fair pricing for farmers who grow sustainably while simultaneously keeping the cost of that healthy food affordable in disinvested communities. Our in-house food hub, Mandela Produce Distribution, was created to support those local limited resource farmers of color who use sustainable practices and who otherwise lack access to wholesale market channels. So in short, this is really how the nexus of health and wealth building shows up in our work. And then by creating sales channels, like I've shared previously, for those limited resource farmers through our programs, we're creating wealth building opportunities for rural farmers while simultaneously addressing that critical food access need in underserved urban communities. And I guess the last thing I'll say is that, and kind of like the final layer of how we keep the cost of healthy food affordable is through a CalFresh incentive program called Fresh Creds that allows us to offer folks enrolled in SNAP a 50% discount on California grown fruits and vegetables across our program sites. So we don't stop at food access. Access can mean a lot of different things, right? You can bring healthy food into a community, but if it's not affordable and if it's not being sourced from farmers that really need the support of that sales channel, you're only really addressing, I think, one piece of this much more complex and larger ecosystem that impacts the social determinants of health.
Thanks so much. It sounds like you guys have a really holistic approach that's so impressive. It's really hard to do that, right? Because everything's connected, and one injustice can lead to another, and if you follow the line back, it's really hard. So we really commend you for taking this holistic approach. Armando, I'm going to turn it over to you for the same question. How does supporting housing needs address social determinants of health?
Well, as we know, housing and income are two very significant factors in determining our health, right? That's true for all of us, physical health, emotional health. So we have seen over and over again in the Fruitvale and East Oakland, because these are both areas that are predominantly Black, Latino, and Native American, Asian Pacific Islander. It's a very mixed and a very diverse area in Oakland. But unfortunately, some of the investment hasn't always made it this way. We know that these areas have been redlined in the past, and there's still not a lot of investment in terms of banks or major food outlets or significant health providers out here. So when you look at the data, life expectancy drops, in these zip codes. In the Fruitvale, just type 94601, and life expectancy changes just from a few blocks up if you go into the hills. And as we know, that's just the most cruel form of, thing that you can think of, is that where you live can impact, your life expectancy and your health. So we're really, at the Unity Council, our focus is on social equity. We want to make sure that we are contributing to the built environment, to having housing be affordable. Of course, it's very expensive to build new housing. So one of the things that we've been doing for the past couple of years is acquiring naturally, existing affordable housing to preserve low-income buildings and prevent them from going into speculative markets. So we're trying a few different strategies, but we feel like helping folks who already live here, whose parents have lived here and grandparents have lived here, we feel like that's really one of the things that we wanted to help. And so this work and this investment really allows us to do that work so that folks don't have to move somewhere else. And but it's all connected to health, at the end of the day.
Thank you so much. Yeah, I'm from Concord. I heard that you have some programming in Concord, and whenever somebody from my hometown, decides to leave the state, it's always such a, heart-wrenching thing to hear, because I love the Bay Area so much, and I want everyone to be able to prosper here. So Abner, I want to turn it back over to you. So you're more directly in the healthcare space itself. So how do you see on your end the social determinants of health impacting your work? And are there other upstream interventions that we maybe haven't talked about yet today that we should be looking at?
Sure. So as I shared earlier, what the unique approach Consejo Sano takes is that we use data to understand who people are. We think that understanding who they are culturally is the best way to build that trust and reach out to them and get them to bring their kid in for a required well child visit. So we while doing that work, as well as all sorts of other quality measures, what we found is that these patients were telling us why they couldn't bring their kid in. So we're reaching out to say, you need to bring your child in for a well child screening. And they're telling us, without us really asking, what are the impediments that are getting in the way of them bringing their child in? And we realized pretty quickly that because we're building a trusted relationship, and trust is key here, these folks are telling us things they didn't tell their health plan before, or they didn't tell their provider. And we realized pretty quickly that we were in a position to survey for the social determinants, and get true answers. Because it turns out that just because people are low income, they still have pride and they still have a sense of self-worth. And it's hard to say, I don't have food to feed my kids. That's not an easy thing to say. It's not even easy to say, I don't have rent now. And if I don't get some money soon, I'm gonna be put out at the end of the month. But we were finding people were telling us these things because we built a trusted relationship. So we said, why don't we actually proactively survey, and let's use our approach and survey, ask these folks what are the social determinants in their lives. And I'm really proud to say we recently signed a new partnership with a large health system where we're going to be doing the surveying for all of their patient population. And they have partnered with a SDOH company. In this instance, it's NowPow, but we can work with other groups like Unite Us and Healthify and TAV Health and others. But this one is with NowPow. So we'll survey the patient population, find out what those issues are in the patient's lives, so SDOH issues, pass that information on to NowPow, and they then can access community-based groups in where those patients live to help solve those problems. So it's an end-to-end SDOH solution. It's really beautiful. I'm excited about it. I think it's a new area for us at Consejo Sano. But here's the quick thing I want to say quickly. We are in a situation where the folks who are most likely to be able to make a difference when it comes to SDOH issues, and I'm talking about the Medicaid plans here and large health systems like Kaiser, for example. These are institutions that are in the Medicaid plans and large health systems. They're in a position to help patients to address the SDOH issues, not necessarily pay for it, but to connect them with resources in the community. But here's the thing, patients don't think to call their health plan when they don't have food. They don't think to call the health system when they're going to get put out of their house. And so we've got this weird situation where the entities in society that are the best able to help people address these issues are least likely to be called upon by the actual consumer or the patient. And if we can fix that, if we can bridge that gap, I think that we can make a lot of headway in the SDOH area. And that's why I'm excited about this large health system partnering with us. I'm not saying the health system has to pay for it or the plan, but they can be part of connecting that member or that patient to services in the community that patient or that member doesn't know about, but could really address their needs. And so I think there's a lot of exciting opportunity here. And I hope to be sharing some good results in the near future with this new initiative that we're doing.
That's great. Thanks so much. So I want to get a little bit deeper into the fund itself and what, Armando, I think, went into some detail into what exactly they're using the impact fund for. And I want to give Abner and Sierra a chance to share those specifics as well. So Abner, how about I turn it over to you first?
Sure. The key way that we're using the funding is further building out our technology. What we do at Consejo Sano, as I said, is use data to design engagement that feels like it's coming from someone that you know and trust. To do that at scale, today we're serving about 1.5 million patients. We want to grow that to 5 to 10 million over the next 2 to 3 years. In order for us to do that, we have got to build out our technology in a much more robust way to go from serving 1.5 million to serving 5 to 10 million. So a large chunk of the funding will go to build out our technology. And in addition to that, a large chunk will go to adding additional team members because understanding, we hire from the communities we serve. If you look at our team, it looks like the United Nations because if it's easier to build trust if you're talking to somebody who looks like you, who talks like you, who has shared your experiences, who's walked in your shoes. And so the funding will help us to identify those people and bring them onto our team. So it's technology and team members.
That's great. Sierra?
Yeah, we are using these funds to expand into a larger distribution facility. Right now, Mandela Produce Distribution, our food hub, is operating out of a space that's a little under 2,000 square feet. We have a pretty lean team. It's tight. We're able to move, close to 100,000 pounds of produce out of that facility in a month. But we are definitely hitting our threshold and what we can do in terms of just volume in whole cases of produce, but also the prepackaged produce boxes, our multi-farm CSA boxes. So this expansion would increase our capacity to just package and distribute more of those CSA boxes to SNAP, CalFresh beneficiaries. It would allow us to work with more farmers. Right now, we're having to kind of allocate a certain percentage of produce that we source to specific farmers. And it's a goal of ours to really grow that network so that we're just offering more sales channel support to more limited resource farmers that are being impacted by the pandemic. And then once we actually locate and move into a new space, we want to build out a value-added fresh product line that we would then distribute to food e-commerce companies, other client partner institutions that are really posed to grow in the post-pandemic economy. Yeah, and I think lastly, I'll say that this approach is going to allow us to support job opportunities with residents in the communities that we serve, obviously strengthen, long-term food access needs, and then uplift local economic development in the process. So we're really excited to be able to actually really look into a new space. This has been a big barrier for us for a long time. So this is a huge investment for our distribution center.
That's wonderful. So we, are coming close to our time together, but I want to end with a question on a positive note around, we don't just do this to do this. We do this because you're all doing this because you want to be serving the community. And so what is the community? It's comprised of individuals, right? And so what are you hearing from clients about your programs and their impact? I want to know if there's any client success stories that you'd like to share with us. And I'll start with Armando.
Yes, so we actually, there's so much that I could tell you, but I'm thinking of a woman who is a business owner in the Fruitvale area. She has a small, what's called a hair salon here in the Fruitvale. And so of course she had to close her business for the first, I think, 4 months of the epidemic. And then when we started our financial assistance program, she reached out to someone on the staff, felt like she wasn't eligible because she had a business. But once we screened her, her income was below 50% area median income. And I just wanted to share that because I think sometimes we think of business owners as, sort of wealthy or, people can fend for themselves kind of thing. And I think when we look at the Fruitvale and when we look at other parts in Oakland, that where businesses are owned by Black, brown, or other communities of color or immigrant communities, they may not have the equity lines of credit or the loans from the banks, and so it was really important for us to help her, and so we were able to help her apply for a grant from the City of Oakland, and there was another small grant from philanthropy. And so she was able to qualify for that, and she was really just incredibly thankful. But we were just doing what we do, and we were also able to connect some of her staff or some of her folks who cut hair to our rental assistance program, because she was also worried about that she would have to lay them off, and then how do you get them back if they find some other work? So all these things are just multiple issues happening all at once. Right now.
Absolutely, that's great. Abner, I'll turn it over to you. Client success stories.
Sure. So I'd say that where we're having an enormous amount of success is closing gaps in care for our Medicaid plan partners and the providers who work with them. There are screenings required in the Medicaid program. For instance, babies, when they're born in the first 24 months of life, have to get vaccinations. There are 10 vaccinations. It's called the combo 10. And it's crazy to think that a baby born today is going to get foot and mouth disease, because these diseases that should have been, gone forever and long in history. But if you don't get that kid vaccinated, they can get these things, polio, measles, all these things are included in the combo 10. And so building a relationship with that mom or that dad or the grandmother, whoever's responsible for that child, and navigating them in, telling them why the baby needs the vaccinations, and then helping them make the appointment, getting them transportation if they don't have it, helping them identify where the clinic is and getting them in. We've been able to and when the baby hasn't gotten the vaccinations, it's called a gap in care. We have clients that had gaps in care in the combo 10 area, of upwards of 50-60% of the babies who are in the plan, and the goal, the state sets goals, and it's more like 60-70%. We have been able to get clients from, say, 30-40% up to above the state's goal of 70-80%. So because we built a trusted relationship, we're able to navigate that baby in. And the same thing goes for well child visits at the 3-year-old and 4-year-old and 5-year-old age. You got to bring that child in for a physical, because you want to catch something early, because if you don't, that issue could have a detrimental effect and constrain the ability of that child to lead a full life for the rest of their life. So that's why you do these well child visits. Huge gaps in care across all of our Medicaid plans, and we've been able to reduce those gaps by reaching out and communicating, building a trusted relationship with whoever's responsible for that child, and getting them into care. In one case, we had so much success that one of our FQHC clients said, "You got to stop, because we're being inundated with calls. We just don't have enough appointments." And so we had to sort of throttle back. But it gives you a sense that if you treat people like who they are matters, and our healthcare system doesn't do that today for the most part. But if you do, they will respond, because people want to be healthy. They want to have their kids healthy. And if you connect with them, build trust, they will respond. And we're seeing that.
That's great. Thanks so much, Abner. And Sierra, do you want to finish us off? Maybe just keep it to a minute, because I think that Denise has to hop off at 11 exactly. And so I want to give her a little bit of time at the end if she wants to share any remarks.
Yeah, I'll keep it really brief. We've seen, I think, a lot of really wonderful testimonials from the folks that are receiving our food, and also from the farmers that we've been able to support with produce purchases. So many of the farmers that we work with year in, year out, really rely on our food access programs to be a sales channel for their product. And COVID, in a way, presented this weird opportunity to support local growers. I think, just to sum it up, we've been able to maintain the sales channel for farmers that is simultaneously feeding communities in need. We've been able to deploy, like I said, rent and loan payment relief to our incubated businesses, and also provide seed capital to entrepreneurs that are obviously really struggling right now, especially in the restaurant space. So I'll just keep it at that.
Thanks so much. You're all doing such really impressive, important work. And so with the last couple of minutes, I do want to give Denise a chance, and the American Heart Association team, if they have any closing remarks.
Well, I'll keep mine brief, and I'll leave the last remarks in this case to Max, who's actually on the ground working with the organizations. But I just can't tell you, my heart is full, because what you guys have, each of you have shared in terms of the work that you're doing in our communities is exactly what this fund is all about in terms of the results that you've been able to achieve, working with your various constituencies, that I so look forward to us continuing to support you. And even, one of the things that's important, as we mentioned early on, is looking for models like yours that are sustainable business models, that potentially, in terms of helping you scale and grow, that there may be other communities beyond the Bay Area where your model makes sense. And that's one of, for me, the beauties of working with the American Heart Association, is that it is a nationwide organization with people on the ground in all the communities where we live and other people live, that I just say bravo. and thank you, on the eve of my late husband's passing, that I know he's smiling in heaven in terms of the work that y'all are doing. So thank you, and keep up the amazing work that you're doing in terms of serving the people who need your support.
Thanks so much for joining us, Denise, and your leadership on this. Max, do you want to bring us home?
Sure, absolutely. I think we have a slide. I don't know if one of my teammates wants to put that up. Otherwise, thank everyone for taking the time to be on this webinar today. Special thanks to our new investees who took time out of their very busy days to share their work with us. If you all who attended are interested in supporting or investing in the Bernard J. Tyson Fund, please feel free to reach out to Erica directly. Her email is on this slide. You can also go to our webpage to learn a little bit more about the fund and what I went over today. But yeah, we look forward to hearing from you, and thank you again.
Thanks everyone for joining. We're going to send out an email with a recording of this webinar so you don't have to miss anything. So thanks so much, and have a good rest of everyone's day.
And thank you, Rochelle and the Bay Area Council.
Thank you.
Thanks.